So the issue that we needed to address at my GP surgery was that we had a few significant events that came through regarding patients whereby they'd been admitted to hospital and then discharged, and either their medicines hadn't been updated after the discharge had been completed by the surgery, or it might have been that actions weren't followed up, so they were asked to go for a blood test or something like that and we never organised it. GP time is at a minimum, as in they're stretched so much. So we wanted to look to see whether there's other staff roles that could take over, or better do almost, that job of kind of the clinical action plan once a patient's discharged from hospital. And then the first major change that we made was that we wanted to put a template onto System 1, which is our patient record system that we have online, so that when the discharge summary came into the system, we had a dedicated template that the staff member was used to prompt them to make sure that they did things like making sure the blood tests were done, making sure the drugs were updated, was there any referrals that needed to happen, did the patient need a follow-up appointment, to almost help them as a bit of a checklist to make sure that these actions were done. So once we'd put those changes in, we did find that when we then re-evaluated the data, 84% of discharge summaries were having an action plan completed within the 2 working days of receipt in the surgery. So that had improved. To make a QI project successful, I think identifying your team and making sure they've got protected time and having clear communication about what you're trying to do.